So the question was, if you're having issues with diverticulitis or a specific gut issue, other things fall in that category, IBS, celiac, Crohn's, what does that specifically do to the brain? So talking about those different connection points, so like it does affect, again, the nerve signaling. It puts the brain more into a state of fight or flight, which produces a series of hormones that encourage more of an inflammatory presence in the brain. A important thing to note maybe is that we have different what are called barriers. The gut, we talk about this a lot in the terms of what people often say is leaky gut, but it's the barrier that's between the space that is in the digestive tract and then the blood itself. And so if this has become compromised with diverticulitis, because you get this inflammation in that inside of that tract, and it compromises that barrier, then it starts to release hormones and release chemicals into the blood that then often starts to compromise the blood-brain barrier as well. So you have multiple barriers in the body, and once they start getting compromised, you usually see a cascade that occurs. So just like there's an inflammation response that happens here, you get the same inflammation response that starts happening internally. And so people can often feel it and experience here as like bloating or phases of like constipation back to diarrhea or just this constant sense of uncomfortableness. Well, that actually is happening up here too. And people just don't feel it the same way because here it feels expanded. Up here it feels more like maybe like headaches or can't think straight or like brain fog and this difficulty in that process. And so while again, which way is which, with the diverticulitis, you start decreasing the proper breakdowns of foods, and you end up with issues of maybe absorption and getting proper nutrients that then the brain needs, particularly in the space of amino acids or protein structures. So that only amplifies the problem up the line with the brain. And so, part of it goes a little bit both ways, right? And so with the diverticulitis, it is trying to calm down the digestive tract. At the same time, you're trying to calm down the brain at that point.
There's also some, depending on what you're looking for, there's also some types of testing you could look for to see if one was causing the other. Or there's like some trial and error things, right? Like sometimes if we're not exactly sure where constipation is coming from, for example, constipation a lot of times comes from the brain. So we may put you on some supplements to help move, and if it doesn't, then we may try some things to help stimulate the brain and see if that does it, So there's always some piecing together, some trial and error, different things, and some different like functional testing we do in the office that you can kind of see, hey, is this coming from here? Is it coming from here?
Mm-hmm.